Yes po. So, good morning everyone. We are Group 5 and our topic is all about bodies recovered from water, immersion, and drowning. Presented by um, Alisa Minet de la Roca and truly yours, Jan Erica Therese M. Santor. So, our agenda for today, we will tackle about what is drowning and immersion. Bodies recovered from water may have died from what cause, um, what are the physiology of drowning, what are the early postmortem changes affected by what, anaerobic nature of decomposition, deaths due to immersion in water, what are the signs of immersion, what why do corpse float, what are the signs that may support the conclusion of drowning? What are the role of the autopsy? Specific significant organs system, statistics and risk factor of drowning around the world, and possibility findings in a body recovered from water but not specifically associated with drowning, and our case study. First, what is drowning? Before we tackle the rest, let's discuss about what is the meaning and the difference between the submersion and immersion. So drowning is formally defined as the process of experiencing respiratory impairment from submersion and or immersion in liquid. So immersion is being partly covered by a liquid. And kung sa medical term naman, ito yung usually includes the face or exposure to water. Ang immersion, ang best example na is this picture. Immersion is like you are above the water, kaya mo pang iangat yung ulo mo at kamay mo to ask help, while the submersion is the act of being completely covered by water or by liquid. Unlike immersion, ito hindi mo na kayang i-force yung sarili mo to um to keep up above the water. And meron din siyang 5 stages or kind of drowning, which are the near drowning, dry drowning, freshwater drowning, saltwater drowning, and secondary drowning. Yung near drowning, dito yung victim ay naligtas before the point of death or there is temporary survival. While the dry drowning, when a drowning person sinks and becomes more deeply unconscious, the stimulus to breathe is still present. As they try to breathe, water enters the pharynx, simulating the reflex that closes the larynx and epiglottis, and thus diverting water to the stomach. Dahil nabarado na yung airway ng victim, ay nakaranas na siya ng suffocation. And approximately 10% ng drowning are dry drowning where the water has not entered the lungs. Yung freshwater drowning naman, when external respiration or yung exchange ng gases sa lungs is interfered with by fresh water enter the lungs, the body will absorb the water into the blood. Next is yung saltwater drowning. Yung pinagkaibahan nila ng salt and freshwater drowning ay yung fresh, nag-e-enter siya first sa lungs and later on absorbed by the blood. Dito naman sa salt drowning ay nagdo-drawn muna sa blood papuntang lungs. And sa salt drowning, with the viscosity of the blood increase, the circulation becomes sluggish, slowing the heart rate until the point of cardiac arrest. And yung cardiac arrest may occur up to 12 minutes after the rescue. And pag ang victim ay nalunod sa salt water, ang residual water in the lungs can draw fluid from bloodstream na nagkakos ng pulmonary edema or shock lung syndrome that which may occur may hours after the event. And lastly is the secondary drowning. When a victim of drowning is successfully rescued and resuscitated, they may appear to be fully recovered but could still die. If the water has entered the body of the victim, rapidly absorption from the stomach to the bloodstream will take place, causing hemodilution and distortion of pH balance, which could kill patient up to 72 hours. But the terms such as near drowning, wet drowning, and dry drowning will used historically are no longer used. Um, ang outcome na ng drowning have been simplified to no, no morbidity, and death. Drowning may be further classified as cold water and warm water. Yan. Next is take to make this important to make this distinction. First, bodies from domestic environment, including ponds, swimming pools, baths, or buckets, will usually be relatively fresh, as will bodies recovered quickly from open water. Dito, tatandaan lang um, na mas madaling ma-discover yung or ma-recover yung body sa open water because yung domestic environment na including yung mga swimming pool ay madali mo makita at hindi malawak yung area na paglulunuran ng victim. And the next, while by contrast, some bodies recovered from rivers, lakes, or the sea will have been in the water for prolonged periods and may demonstrate variable degrees of decomposition, postmortem predation, and mutilation may occur relatively quickly after entry of the body into water depending on the circumstances. Dito naman, mas mahabang panahon or oras yung mahanap yung bodies because yung rivers, lakes, and the sea ay masyadong malawak and meron kasi siyang tinatawag na current or yung may current yung rivers and sea, kaya may possibility na maanod yung body. And dahil nga body of the water, ay papasok na dito yung animal predation and mutilation. Sa animal predation, papasok na yung animals or wild animals around the area. And next, bodies from water may have died of natural cause before entering. The example of this is yung mga inatake ng heart attack while fishing or even just walking near the water and sudden or nahulog sila mismo sa tubig and died of natural cause says while in the water. Ang magandang example dito is yung may mga seizure while they taking a shower in the bathtub, pag may bigla silang nagkaroon ng episode ng pagsi-seizure and no one is there to help them earlier, doon na magkakaroon ng death while in the water. Next is died from exposure or hypothermia. Next is died of a natural cause before entering. Sa unnatural cause is like may nangyari na sa'yo before ka itapon sa water. Like, example, someone killed you and they want to dispose your body. Kaya tinapon ka na lang nila sa tubig para mahirapan na rin mahanap yung cause of death mo. Next, died of injuries sustained while in water. Yung dito papasok yung sa current. Pag malakas yung current and nanaanod ka sa mga batong part, and doon and upon having injuries, hindi mo na kayang lumangoy paangat or eto na yung may mga case na nababagok or tumatama yung ulo sa mga bato. And last, and died of submersion in water. And last is died of true drowning. Next is physiology of drowning. Two different events, immersion, upper airway above water, and submersion, upper airway underwater. So immersion involves integrated cardiorespiratory responses to skin and deep body temperature, including cold shock, physical incapacitation, and hypovolemia as precursors of collapse and submersion. Yung submersion includes fear of drowning or aquaphobia or thalassophobia pag fear of deep water. Diving response, autonomic conflict, upper airway reflex, water aspiration and swallowing, emesis and electrolyte disorders. Submersion outcome is determined by cardiac, pulmonary, and neurological injury. Next, warning lang po sa mga nag-aalmusal dahil yung mga pictures po sa susunod na mga slides is hindi ka aya-aya or baka masuka po kayo. So, early postmortem changes. If a body of water is primary death scene and the body has been immersed for only a short period of time, the position of the body will be affected by clotting and any personal effects on the body. And sa makikita nyo sa picture, it can be a misleading case. Why? If this victim is really a victim of drowning, why he has a blindfold and sira yung damit niya. If you investigating a drowning incident, mapapaisip ka. Kasi hindi naman normal na malunod ka na may blindfold and ganyan yung damit mo. Next. This is called drowning position. This is where the anterior aspect of individual faces the bottom of the body of the water and the extremities and head hang downward toward the bottom while the individual's back is toward the surface. As the body enters the shallow water, the distal extremities and forehead are frequently dragged along the bottom. Next. Early postmortem changes. In shallow water, the hands, knees, dorsal aspect of the feet, and the forehead may drag along the bottom, creating postmortem cutaneous abrasions that may be difficult to differentiate from antemortem injuries. Yung antemortem injuries refers to events occurring prior sa pagkamatay. These abrasions will be exaggerated in a strong current or rough sea state that remains may strike rock or brush with enough force to create the appearance of significant external trauma to the body. Last, early postmortem changes. The usual postmortem changes of vascular marbling, dark discoloration of water and soft tissue, bloating, and putrefaction occur in the water as they do not land to at a different rate, particularly in the cold water. Sloughing of the skin, particularly involving the hands and feet, is common with prolonged immersion. And next, postmortem changes affected by temperature, current, and animal predation. In temperature and current, the temperature of the water will be cooler than the ambient air temperature. Mapapansin natin yun pag Mapapansin natin yan sa pag nag-dip tayo sa swimming pool. mas malamig sa lower part kung ano yung naka-deep sa water, and mas malamig siya dun sa upper part na hindi. Cooler temperatures generally slow the decomposition process. Exceptions include hot tubs and tropical bodies of water. Current has primarily a mechanical effect on bodies in water. The body itself may be dragged for a distance, creating artifacts that can be mistaken for injuries and fit. Dito na nga papasok yung mga example ko earlier sa strong current na pwedeng maanod ka sa matalim o matulis na bato that can cause you an injury or an abrasion. Next is animal predation. Aquatic insects may alter the appearance and condition of the remains. Large animals and large crustaceans will cause tissue damage that in some cases may mimic trauma to the body. Next is anaerobic nature of decomposition for wet remains. Adipocere formation may occur in wet or immersed bodies. It is a yellow-brown waxy material composed of long-chain hydrocarbons such as aloic, palmitic, and stearic acids. It is produced by the conversion of natural lipids to these compounds as part of the putrefaction process. The formation of adipocere usually occurs over somewhat lengthy postmortem period, typically 7 to 9 months. So first picture, remains covered from the moist environment. And the second is same lang sila, but ito yung itsura niya pag skeleton or skeletal na lang yung na-recover mong remains. Next, on the surface of solid organs. A similar putrefaction change may be observed on the surface of solid organs, particularly the liver, and on the surfaces of mucous membranes. White spots that have a somewhat miliary appearance have been observed in bodies that have been submerged from prolonged periods. This is presumed to be a breakdown of lipids in a process like adipocere formation or saponification. The saponification is the formation of metallic salt of the fatty acids. Next, deaths due to immersion in water. Some victims appear to die as a result of reflex cardiac arrest, automatic conflict when immersed in water, particularly cold water. When the features of drowning will not be present, some refers to this specifically as dry drowning. Hypothermia, it should be recognized that hypothermia be a significant factor in causing death in water. Hypothermia is a medical emergency that occurs when your body loses heat faster than it can produce heat, that causing dangerously low body temperature. Next po, Miss Alisa.
Hello po, I'm Eliza, your next presenter. Next is signs of immersion. First is thick, thick keratin on palms and soles becomes pale and wrinkled. Washerwoman fingers. Yung development po ng washerwoman fingers or hands depends po sa length of immersion. Pero observable na po siya sa 1 to 4 hours after death. Next is decomposition delayed relative to air. Lalo na po dun sa malalamig na temperatures, magiging mabagal nga po yung decomposition of the body. Float to surface with gas accumulation. Post-mortem artifacts due to predation, contact with riverbed, bridges, rocks, propellers, etc. So madadagdagan po yung injuries sa bodies po, lalo na kapag nadadagil po ng mga objects, lalo na po sa riverbeds, rocks, propellers, etc. No hypostasis due to movement in water. Wala po siyang settling of blood dahil po sa water current. Next. Next. So different types of water immersion. Hot water immersion. Thermoneutral is the term for the water temperature at which heat loss equals heat production. Most drowning events occur at water temperatures below the point of thermoneutrality, which is 35 degrees Celsius plus minus 0.5. Some drownings, however, occur in hot water tubs while pouring hot water over the head or during diving or competitive swimming in warm water. Next po. Next is cold water immersion. Most drownings occur in water colder than thermoneutral temperature, thus initiating physiological responses associated with cooling. In cold water, the responses that act as precursors to drowning are evoked by skin cooling, cold shock, then cooling of superficial nerves and muscles in the limbs, and finally cooling of deep body tissues, hyperthermia. So meron pong stages yung cold water immersion. So yung first po ay yung skin cooling, yung cold shock, paglamig po ng balat natin, then cooling of nerves, superficial nerves, and then sa deep body tissues or hyperthermia. Next is cold shock. After a fall into cold water, any intention to freeze cold can be overcome by cold shock. The response starts in water, approximately 25 degrees Celsius, and peaks somewhere between 15 and 10 degrees Celsius. It peaks in the first 30 seconds of immersion and attenuates during the next 2 to 3 minutes. It is evoked by cold receptors located in the superficial subepidermal layer of the skin, below approximately 19 degrees Celsius. Cold nociceptors contribute to the response with a sensation of intense cold pain being experienced in water below approximately 5 degrees Celsius. The cold shock response may be decreased but is still present in those with high body temperature. Yung cold shock po ay mataas po yung response sa first 30 seconds of immersion. Then bumababa nga po sa within 2 to 3 minutes. Then mabawasan lang po yung cold shock response kapag high body temperature lang po yung body. Next po. Why do corpses float? So initially, bodies will likely sink to the bottom of a body of water, but as they decompose, gases are released through the process, causing the corpse to rise back to the surface as a result of buoyancy. Most drowned bodies initially float face downwards owing to the weight of the arms, excess fat in breast and stomach. However, since fat floats may produce a face-up effect, the putrefaction of flesh produces gases, primarily in the chest and gut. that inflate a corpse like a balloon. In warm, shallow water, decomposition works quickly, surfacing a corpse within 2 or 3 days. But cold water slows decay, and people who drown in deep lakes 30 meters or below may never surface. So, pag-float nga po ng corpse, dahil po naglalabas po ng gases yung body, and nakadepende po talaga sa weight of arms and excess fat in breast and stomach. Yung position po ng drowned body, kung float face up or face downwards. So in warm condition, mas mabilis po yung decomposition and mag-float po siya within 2 to 3 days. Next. Signs that may support a conclusion of drowning include: first is froth or plume around the mouth and nostrils from aspirated liquid mixed with air and pulmonary surfactant, sometimes referred to as the champignon de mousse. This may have been washed away and may be transient, but it is seen in other circumstances such as coma, example given from sedative drug intoxication or severe cardiac failure. Yung froth minsan po ay pinkish bubbly foam, and the form occurs when the victim was attempting to breathe in the water. And then nagmi-mix po yung water and air that cause froth, and nagbi-build up po siya sa lungs and trachea. Then nagdi-leak out na po siya sa mouth and nostrils. Next. Next is frothy fluid in airways, which may also contain extrinsic materials such as silk, weeds, or sand. Over distended lungs, sometimes to the extent that they are seen to overlap when the chest is open. They may be heavy, but a normal lung weight does not exclude drowning. Over distended lungs, yun po yung enlarged, paglaki po ng lungs as a result of trapped air. Next po. Emphysema causa. Alternating segmental overdistinction and collapse with the characteristic of doughy nature to palpitation. So, dito naman po ay yung air sacs of the lungs are collapse and enlarge. So, overdistension and collapse. Next. Signs that may support a conclusion of drowning include watery fluid and debris in stomach suggest immersion during life, but does not confirm drowning. Other signs previously described is not drowning. Pleural fluid accumulation, usually in saltwater drowning. Yung pleural po yun yung sac na nag-surround ng ating lungs. So, fluid accumulation. Next po. Middle ear mastoid congestion and hemorrhage asphyxiation. Yung caused by the blockage of water. Then hemolytic staining of the endothelium of the aorta and carotids, which also occur with decomposition. Yung discoloration of the heart chambers after drowning. Next. The role of the autopsy: to identify potentially suspicious issues and thereby diminish or exclude the risk of undetected crime or homicide, to document injuries present and other relevant findings to permit accurate interpretation, including by others at a later stage if required, to determine the medical cause of death, to determine contributory factors if it is drowning, to identify non-drowning cases of death in bodies retrieved from water, to assist with identification, particularly in cases of prolonged immersion with decomposition or mutilation. Next one. The big three: fingerprints, teeth, DNA. When human remains are recovered, 3 primary scientific methods are traditionally used to identify who they belong to. So first is fingerprint analysis. which looks at the skin patterns on the tips of the fingers, except in decomposed bodies. Sa fingerprint analysis, pwede pong kuhanin yung fingerprint, pero depende na nga lang po sa condition ng skin. And dental analysis, which looks at the teeth and any dental work such as crowns and fillings. DNA analysis, which looks at DNA profiles recovered from soft or hard tissues. This information can be compared to a database of fingerprint, dental, or DNA records. In addition, the pattern of the palate, nasal bones, and cheekbones for racial identification, head and pelvis for sex, teeth and sutures in the skull, and visualization of the ossification center for age identification, and the femur bone for height and identification using the Trotter Glaser formula. Next one. So this is the primary yung tinitingnan po lagi sa autopsy, specific significant organ systems. Lungs, emphysema of osum, pulmonary edema, pleural hemorrhage, frothy admixture of bronchial secretions with aspirated liquid and foreign material in airways, evidence of pre-existing pulmonary disease. Sa heart, evidence of underlying cardiac pathology, example given, coronary artery disease or cardiomyopathy. Sa stomach, fluid and debris content. Next po. Sa toxicology, should be performed in all bodies recovered from water unless this is precluded by severe decomposition or refused by the coroner. So, nakadepende po sa condition ng body. So specimens recommended for best practice include the following, although advice should always be sought from the local toxicology provider. Peripheral blood, femoral or femoral vein, unpreserved and preserved in fluoride, urine, unpreserved and preserved in fluoride, vitreous femur, and lastly, stomach contents. Next.
Before we tackle about the statistics and risk factors of the drowning around the world, I think I miss or skip one early postmortem. This one. I'm sorry if I skipped this one. So perhaps the most well-known external change that immersion as liquid has on the body is wrinkling on the skin, particularly involving the hands and feet. This is called washerwoman's hands or washerwoman's changes. Excuse me. Though a better designation on the autopsy report would be cutaneous changes after immersion. Cutis anserina or goose flesh is another cutaneous change of immersion and is caused by rigor of the erector peeling muscles within the skin. Cutis anserina is a temporary local change in the skin when it becomes rougher due to erection of little muscle as from cold, fear, or excitement. Both of these changes, wrinkling and cutis anserina, will occur as a postmortem change and do not require the individual to be alive upon entering the water. So let's go back to the statistics. The reference of this is from WHO or World Organization, Health Organization. An estimated 236,000 people died from drowning, making drowning a major public health problem around the world in 2009. Injuries accounted for almost 8% of total global mortality. Third leading cause of unintentional injury death, accounting for 7% of all injury-related deaths. The global burden and death from drowning is found in all economies and regions. However, low and middle income countries account for over 90% of unintentional drowning deaths. Next is over half of world drowning occurs in the whole Western Pacific region and the Southeast Asia region. Drowning death rates are highest in the Western Pacific region and are 27 to 32 times higher than those seen in the United Kingdom and Germany, respectively. What are the risk factor? The risk factor are age, gender, access to water, flood disaster, and traveling to water. In 2014, age is one of the major factors for drowning. Globally, the highest drowning rates are among children 1 to 4 years old, followed by children 5 to 9 years old. And in Western Pacific region, children aged 5 to 14 years old die more frequently from drowning than any other cause. Child drowning statistic from number of countries presented by Global Report. In 48 to 85 countries, drowning is the top 5 causes of death aged to 1 to 14 years old. And in Australia, it is the leading cause for unintentional injury death aged for 1 to 3 years old. In Bangladesh, 43% of all deaths in children aged 1 to 4 years old. And in China, it is the leading cause of injury death in children aged to 1 to 14 years old. And in US, it is the second leading cause of unintentional injury death in children aged 1 to 14 years old. Next is gender. Males are specifically at risk of drowning, with twice the overall mortality rate of females. They are more likely to be hospitalized than females for non-fatal drowning. Studies suggest that the higher drowning rates among males are due to increase or exposure to water and riskier behavior such as swimming alone or pupunta sila na nakainom before swimming alone and boating. Next is access to water. Increased access to water is another risk factor for drowning. Individuals with occupations such as commercial fishing or fishing for subsistence using small boats in low-income countries are more prone to drowning. Children who live near open water sources such as ditches, ponds, irrigation channels, or pools are especially at risk. Kaya nga yung ibang country, naglalagay sila ng fences o yung harang dun sa mismong pools nila kasi nga hindi naman malaki yung possibility na malunod yung anak nila, especially yung mga bata pa na hindi naman alam yung ganun. Next is flood disasters. Drowning accounts for 75% of deaths in flood disasters. Drowning risk increase with floods, particularly in low and middle income countries where people live in flood-prone areas and the ability to warn, evacuate, or protect communities from floods is weak or only just developing. Next is traveling on water. Daily commuting and journeys made by migrants or asylum seekers often take place on overcrowded, unsafe vessels, lacking safety equipment, or are operated by personnel untrained in dealing with transport incidents or navigation. Personnel under the influence of alcohol or drug are also a risk. Next po.
So next po ay possible findings in a body recovered from water, not, not specifically associated with drowning. The findings below are influenced by multitude of factors that include duration of immersion, water temperature, and whether water was salt water or fresh water, still or flowing water, or clean or polluted. Immersion modifies most changes observed after that. First po ay variable decomposition. Cold water will tend to refrigerate the body, retarding decomposition, but allowing an increased amount of time for post-mortem predation and damage from the environment, including shipping. In extreme circumstances, only skeletal fragments may be recovered. So, katulad lang din po kanina na mas mabagal nga po yung decomposition kapag cold water. And sa pagtagal po ng exposure ng body, madami nga po mas increase amount po yung damage from the environment and sa current. Next po. Next po ay lividity. This should match the known position of the body. So ito po yung sa livor mortis, bluish purple discoloration of the skin. And next, maceration of the skin, secondary to immersion of the part of the body. So yung maceration po ay yung long exposure to moisture. So first identified as whitening, soddening, thickening, and wrinkling. With time, the epidermis loses integrity and is lost, so-called washerwoman change with steepage. Next is hemorrhages in the soft tissues of the neck. These are occasionally found in victims recovered from water, but when encountered, a forensic pathologist should consult it as a priority given the potential significance of the finding in relation to homicidal injury of the neck. So, yun po yung appearance of purplish spots or patches of the skin. Next. Case study. First is Claire Remocaldo from Ilaya Bulinawan, Carcar City, Cebu. A victim attending a team building activity died after he drowned while swimming in a pool of resort in Minglanilla town in Cebu on Wednesday afternoon, July 13, 2022. The victim didn't know how to swim. Based on a CCTV footage recorded by resort goer RJ Picada Bacalso, other people swimming in the pool at the time of the incident, which was around 3 p.m., didn't notice that the victim was in distress. Once someone noticed the victim motionless in the pool, a lifeguard of the resort rescued him and immediately performed CPR. But he failed to revive the victim. Bacalso said he recorded the video with someone from the resort watching since they wanted to check if there was a foul play involved. Next. Second case study is a 34 years old attended on the beach by external hospital emergency services after suffering immersion in seawater resulting in drowning due to acute respiratory failure. She was admitted to the critical care unit and an emergency fiber optic bronchoscopy was performed, extracting a large quantity of sand and algae. The respiratory function improved and FiO2 requirements were gradually reduced following the procedure. After 8 days of mechanical ventilation, the patient was extubated with good clinical tolerance and was transferred to a ward. Next po. Last case study, Nancy Candiff, 29, and Vanessa Baker, 60. The body was found on the bank of Troublesome Creek near Highway 476 in the Clay Hole community, according to Epperson. It was transported to the medical examiner's office where it's still undergoing identification. Epperson said it's a good possibility the body may be one of the two missing Petit County woman from the deadly eastern Kentucky floods in July, but he couldn't confirm that's the case. Cundiff and Baker have been missing since the devastating floods. Both were last seen at their residences in the area of Lower River Kenny Road. Cundiff lived in the Clayhole community according to Epperson. Her adoptive mother was in the residence with her at the time and died according to Epperson. The identification of the body could take anywhere from a few days to a few months, Epperson said, if they can use dental records to determine the identity, then it will take a short amount of time. But if that's not possible, then they'll identify the body with DNA records. That could take approximately 2 to 3 months before results came back. Next one. Takeaway message. Drowning defined as a process of experiencing respiratory impairment from submersion or immersion in liquid. Next one. Important distinction. Bodies collected in swimming pool, ponds, and baths will recover quickly from deep water. Bodies collected in rivers, lakes, and sea will recover prolonged period. Next. Risk factor of drowning. Age, gender, access to water, flood disasters, traveling on water. Drowning position, washerwoman hands or washerwoman's changes.
This is all for our report. Thank you for listening.
Okay na, Miss Jan. Hello?
Yes po.
Nasa akin na ba yung control?
Yes po.
Sige. Hindi pa kayo nantok? Hello?
Hello po, Doc.
Hindi kayo nantok?
Di naman po.
Sige. So, ito yung atlas ng pathology books ng Rubins and Cotran. Isishare ko sa inyo. Pathology is a second year medical school subject. 1 year yan subject sa second year. And it deals with diseases of the various organs in the body. And there is a 1 year before that solid background in anatomy and physiology. Gayunpaman, kahit na mayroong solid background in anatomy and physiology, mahirap pa rin aralin. It takes about 6 readings per chapter bago mo matutunan yung sinasabi ng libro. Okay? So this is the heart. Inalis sa autopsy. Yan. This is a normal heart. Okay? See. Ito yung heart. ito yung aorta, in the largest artery in the body. This is the anterior view. Ito yung left side, ito yung right side. Ganyan ang itsura niyan. Pag nag-autopsy ka, makikita mo yan doon sa loob ng chest. Okay, this is the right ventricle, left ventricle, this is the apex. Yan yung pag gumalaw, nakikita sa left side ng breast sa baba, yung kumakabog-kabog, yun yung apex beat. Tawag dyan apex, A-P-E-X, tas beat. Yung pang apex beat, sabayan sa pulso. Okay? So, this is the aortic root. Yan, aortic root, yan. Aortic arch, yan, yung arch na ganyan, papunta na sa baba. Ito yung coronary arteries sa surface ng heart. Pulmonary trunk, ito yung galing sa lungs. Kaya lang manggagaling yan sa lungs. Dito dumaan sa likod ng heart. Ito yung thoracic aorta. Ito yung area na nagkaroon ng leak doon sa kaso ng isang flight attendant during the year 2021 yata, 2022. Natandaan ba ninyo yun? Yung flight attendant? Hello?
Si Dacera po ba?
Oh, yun. Nag-leak yun dito. Yan. Hindi natin alam kung bakit nag-leak. Either na sadyang meron kahinaan yung wall ng aorta niya, kaya nag-leak. O nagkaroon ng aneurysm, yung paglobo, lumobong pa ganyan. Hindi pantay na ganyan, kundi lumobo. Yan. Lumobo. Ganyan. You are free to take snapshots of this. Okay? Yan. Note that the apex is going there. Yan. This is the normal appearance of the apex. Pag ang appearance ng apex ay kagaya nung sa itlog, merong diferensya yung heart. Okay? Ito, yung apex niyan dapat medyo patulis. Pag medyo rounded, may diferensya yung heart. Sa appearance pa lang, sasabihin mo na merong diferensya yung heart o merong diseases yung heart. Itong coronary arteries na yan yung nagbabara. Pag mataas ang cholesterol mo, nababarahan yung loob ng tubo ng arteries. If you recall, the artery is the blood-carrying muscles. They carry oxygen to the tissues. Okay? Ito yung right atrium. Yan. Ito ang left atrium. Okay? Yan. Normally, the heart is situated in the middle of the chest in the anterior mediastinum, slightly to the left. Medyo paganyan yan sa heart. However, merong mga tao na ang heart ay papunta rito sa right. Nakaganyan. Malalaman lamang minsan pag walang symptoms yung tao na right-sided ang inclination ng heart niya during x-ray. However, there are people who are born with abnormalities ay kasama ang right-sided inclination ng heart, which we call dextrocardia. Dextro means right. Yan. Any questions? Hello?
So far po, none po, Doc.
Okay. So, you will notice that the surface of the heart is smooth and glistening. Yan. Pag mayroong problema sa heart na tinatawag na pericarditis, yun yung surface ng heart sa loob ng heart cavity ay merong bread and butter appearance. If you can picture na yung American bread, lagyan mo ng mantikilya, tapos ipagdikit mo, tapos alisin mo, makikita mo yung appearance ng bread and butter appearance of the pericardium. Kuha niyo ibig sabihin, yung tasty, yung American bread, na pag nilagay niyo ng mantikilya, tapos inalis niyo, parang may yung malalambot na mantikilya, parang nahihila. Ginawa ba ninyo yun noong bata pa kayo? Hello? Hello?
Opo, Doc.
Yan yung tatawag na bread and butter appearance sa pericarditis. Yan. So, if you have time after this, you can look at the medical dictionary what is the meaning of pericarditis and bread and butter appearance. Okay. So, this is the appearance of the heart naman sa likod ng heart. Ito yung anterior, yung sa harap, yung una mong makikita pag binuksan mo yung chest, pag tinanggal mo yung ribs. Okay? So the normal heart would be the size of your fist. Pag yung inyong kamay ay ginawa niyong, pag may susuntukin ka, tapos i-form mo yung hand mo ng fist, that is approximately the size of your heart. Yan. Pag ginanyan yung kamay nyo, yan ang laki ng iyong heart. Yan. So this is the back of the heart, posterior one. Ito yung mga blood vessels, yan. Ito ang right ventricle. Tingnan natin kung anong sabi dyan sa right coronary artery, yan. Dahil sa likod, nakatingin tayo sa likod. Papunta sa harap. Yan. Tingnan natin ito isa. Posterior descending artery. Yan. Ito yung apex. Ito yung right ventricle. Ito yung left ventricle. Okay? Still, the surface is smooth and glistening. Ito ang right atrium, left atrium. Yan. Ito yung connection sa lungs. Yan. Ito yung pataas yung sa aorta. Okay? Yan. Next. Ayaw na yata bumalik. Okay? Next. Ayaw mag-proceed. So, this is the normal heart. Yan, gross daw. Yan. Ito naman yung lateral aspect pag nakatingin ka from your left. Okay? So, this is still the apex. Yan, medyo patulis. May diferensya pag kagaya ng sa itlog. Yan, medyo rounded. So, this is the left descending artery. Tingnan natin kung tama tayo. Circumflex artery gives off marginal branches. Okay. Left ventricle. Yan. Ito, anong hula niya? Ito ang left atrium. Hello, anong hula niya? Hello? Gising pa kayo? Hello?
Yes po.
Tingnan natin yung arteries kung ano daw. Gives off marginal branches, circumflex artery. So, dito nanggagaling yung arteries. Papunta dyan. Papunta dyan. Umiikot yan dyan sa ilalim. Etong dilaw na to, yan yung taba ng heart. Yan. Etong mapupula, yan na yung laman ng heart. Yan. Okay ba yon? Next.
Yes po, Doc.
Have you seen an appearance of a normal myocardium? Ito yan. Tingnan. Kung may snapshot nyo, hindi nyo malilimutan yan. Okay. So, this is the normal myocardium. Kumbaga sa picture, yan ang formal picture ng myocardium. Naka-lipstick na yan and edited. Okay? So, these are the muscle fibers. Yan. Notice na merong mga parang ganon-ganon, striations yan. Yan. Striations. Okay? Yan. Cardiac myocytes are a form of striated muscle with units called sarcomeres. Nakuha ba ninyo yan sa anatomy? Hello? Hello?
Yes po.
Kung natatandaan nyo. Yan. So, maraming dapat malaman sa picture na ito. Itong mga reddish na yan, yan yung mga red blood cells. Yan. Yan, red blood cells yan. Na nasa loob ng capillaries. Yan. Nakita niyo itong haba na ito? Yan yung lining ng capillaries. And we call this haba na ito endothelial cells ng capillary. Yan. Yan. Yun. Okay? So, ang nucleus ng myocytes ay ito. Yan. So, it is elongated, basophilic, medyo bluish, with granular, eosinophilic, meaning pinkish cytoplasm. Yan. Kuha niya? Hello?
Yes po, Doc.
So ito, 1 sarcomere. Yan. 1 unit. Yan. So merong muscles in the other parts of the body na called smooth muscles. Na itong mga smooth muscles na to ay nakikita sa mga hair shaft. Yun yung nagpapatindig na inyong balahibo. Kung kayo'y natatakot o nalalamigan. Yun yung binanggit kanina during sa cutis and sirena. Doon sa drowning. Cutis means skin, and sirena yung pabo. So, pag mukhang cutis and sirena ka, ibig sabihin ang yung skin ay parang yung sa pabo, yung sa leeg ng pabo. Nakuha nyo? Hello?
Yes.
Hello? Gising pa kayo? Hello?
Yes po, Doc.
Okay,
Hindi maulan lang po.
Maulan ba?
Yes po.
Okay. Mukhang inaantok kayo. So, the heart has its own automatic kumbaga sa makina, meron siyang automatic firing machine na makes the heart beat. During systole, the blood is pumped outside from the heart. It means the heart contracts, push the blood to the periphery via the aorta, which is the largest artery in the body. During diastole, the heart takes a rest and it is filled up by blood coming from the arm's head. We call them yung mga ano tawag dito, yung venous system. Okay? So this is the normal conduction system of the heart. Yan ang nagpa-fire sa heart to beat automatically, rhythmically. Yan. Ibig sabihin, pantay-pantay ang sukat ng heart beating nyo. Ibig sabihin, rhythmic. Pag hindi pare-pareho ang beat ng heart niya, we call it arrhythmia. Okay. So, merong skip beats. Pag humihinga ka ng malalim, merong skip beats, lalo na sa mga bata na kagaya nyo. Nakagaya nating mga bata, may skip beats. Humihina ang pagbeat ng heart during inspiration, yung paghinga mong paloob. Pero pag palabas, hindi nagkakaroon ng skip beats. Okay? Etong mga reddish-orange na yan, yan yung normal sinoatrial node, which is independent, which fires rhythmically. Yan. Pag matanda na, due to atherosclerosis, yung paninigas ng mga capillaries tsaka blood vessels sa heart due to deposition of cholesterol, we call them atherosclerosis. Less blood supply goes into the heart. When that happens, less blood comes or is given to the sinoatrial node. Natataranta itong sinoatrial node at nagkakaroon ng skip beats sa mga matatanda. Naintindihan ba? Hello?
Yes po, Doc.
Ang daming ano. Ang daming mga sinasabi, isang picture lang, ano. Okay, next. So this is the normal coronary artery. Yung nakita natin na during the first part. Yan, coronary artery yan. Coronary artery, coronary artery. Yan. So ito naman yung histology, the microscopic appearance of the normal coronary artery. Ito yung lumen, butas. Itong lining na to sa loob, we call it intima. Ibig sabihin ng intima, intimately related. Yan, to the lumen, yung butas ng blood vessel. It is intimately in contact with the flow of red blood cells dito. Okay? Ito naman yung black square, which is the medial layer. Yan. Smooth muscles yan. Smooth muscle. So this intima is covered by a thin, flat endothelium. We call it arterial endothelium. Yan. Covering yan. Ito naman yung serosa. Yan. Yung which joins with the connective tissues around the heart. So this is the normal muscle tissue ng heart. Yan. Sometimes you will find fat tissues. Yan. Yan yung mga fat tissues na yan ay hindi different sa other parts of the body. Yung mga taba-taba natin sa tiyan, yan, meron yan. Tsaka yung mga kinakain nating ano yung binibenta na ano? Yung bituka ng baboy, di ba may mga dilaw-dilaw doon. Ito yung appearance niyan. Okay? Yan. Okay? Yan. Ano ba pagbalik nito? Yun, bumalik na naman. Okay. Shown here is a distal coronary artery branch with prominent lumen that is adjacent to myocardium in the upper right. Yan. Okay? Such arteries are anchored by myocardium is like the turbulent like to develop atherosclerosis. Atherosclerosis tends to develop in the proximal portions of the major coronary arteries. Okay. Ibig sabihin, yung malapit na coronary arteries sa source ng blood supply dito ay more prone to development of deposition and hardening of the blood vessels than here. Yan. So, ibig sabihin nun, pag nakita natin sa autopsy na ito ay hardened na, yung matigas na at may cholesterol at yung lumen ay